Welcome to Module number 3. Why should researchers be aware of HIPAA? If you are having trouble accessing any of these modules, contact the Chief Privacy Officer at privacy@uvm.edu or call the Office of Audit, Compliance, and Privacy Services at 802-656-3086. Otherwise, let's begin. The privacy rule regulates the way certain healthcare groups, organizations, or businesses called covered entities handle protected health information, or PHI. Researchers should be aware of the privacy rule because it establishes the conditions under which covered entities can use or disclose PHI for many purposes, including for research. Although not all researchers will have to comply with the privacy rule, the manner in which the rule protects PHI could affect certain aspects of research. It is true that under most of its operations, UVM as an organization does not have to comply with the privacy rule because it is not considered a covered entity. UVM does, however, have covered components when those components provide healthcare treatment services or provide health insurance as a self-insured organization. For the most part, however, UVM's operations do not make it a covered entity. That means that, under most situations, the privacy rule will not directly regulate researchers who are engaged in research, even though they may gather, generate, access, and share personal health information. However, and this is important, even though the privacy rule may not regulate your research, if you are collecting, accessing, or using PHI, you likely rely on covered entities for research support or as sources of this PHI, and likely include this PHI in research repositories or research databases. Even if the privacy rule doesn't regulate your research, it likely will impact researchers as it will affect your relationships with covered entities. For example, in some instances, researchers may have to comply with the privacy rule because they may be a covered entity themselves, or they may work for a covered entity. As you learned in the last module, the privacy rule defines covered entities to include healthcare providers that transmit health information electronically in connection with certain financial and administrative transactions. This includes most hospitals. As such, if you work for a covered entity and also perform research at the university, and your research uses PHI, you need to understand the privacy rule and how it works. Even if the privacy rule doesn't directly cover your research, if you are also an employee of a covered entity, the covered entity likely has established policies describing how PHI can be used and shared. And they probably have defined specific ways in which they and you may use or disclose the PHI it holds, and under what conditions it can allow use or disclosure of the information. Researchers in medical and health-related disciplines rely on access to many sources of health information, from medical records to disease registries and hospital discharge records. Researchers may also gain access from government compilations of vital and health statistics to epidemiological databases. For this reason, the privacy rule may impact various areas of research, including clinical research, repositories and databases, and health services research. For example, health services researchers study the organization, financing, and delivery of healthcare services, often by analyzing large databases of healthcare information maintained by providers, institutions, payers, and government agencies. Clinical researchers often access medical information from patient charts and tissue and data repositories. They create individually identifiable health information in connection with an experimental intervention. All of this requires access, which may be impacted by the privacy rule. For additional information on how the privacy rule may affect specific research areas, pause this video and search for the following, or write down the links for future access. Search Health Services Research and the HIPAA Privacy Rule, or go to this link. Search Privacy Boards and the HIPAA Privacy Rule, or go to this link. Keep in mind that even though the privacy rule may have added a new layer of privacy protections for research subjects by introducing new ways in which covered entities handle PHI, many in the research community have always been concerned about the privacy afforded to subjects' research-related information. In fact, most in the research community were already required under state and/or federal laws to take measures to protect such information from inappropriate use and disclosure. You have now reached the end of module number 3. If you are taking this training as part of a requirement, you will have to answer questions in order to move on. Next up is module number 4. What does the privacy rule do?